Welcome to Caregiver Week. So we have been spending a lot of time caregiving. Actually,
It's been one of those weeks.
As a nurse, I should have married a nurse first because they like caregiving.
You should have married this nurse first.
I should have married this
Only
nurse.
this nurse.
Yes, my life has been so much better since I've been with you. Caregiver Week, we're going to talk about the ins and outs, stresses, joys,
Risks
of taking care
right.
of other people. Actually, it's interesting. Here at Amen Clinics, 60% of our patients are male, but 70% of the calls to the call center,
Wives and mothers,
are females. And so honoring caregivers and also giving you some tips on how to navigate this without feeling either homicidal or suicidal could be really helpful for you, we hope.
Right.
Did you have a review you want to read?
Yes, I have a testimonial. This physician recommends listening to Dr. Amen. A happy, healthy brain is the key to living. A perfectly healthy body with a depressed, anxious, or disrupted mind does not produce a happy life. But there are many examples of people who have impaired bodies who live and are happy. Behavior and nutrition determine brain function and in the end can even overcome genetic predisposition to brain disease. This podcast gives brief, encouraging, easy to understand information supported by evidence on real changes people can make to optimize brain function and happiness. Dr. Amen doesn't keep this information secret or use it for personal gain, but rather he shares it freely. Have a free visit with Dr. Amen every day by listening to his podcast. I love that. Have a free visit with the doctor.
I love that too, although I totally use it for myself, right? And then I get to share it with you.
Right.
And so caregiving has been virtually part of my whole adult life.
Yeah.
I remember when I got married when I was a second-year medical student, my first wife tried to kill herself a couple of months later, and I'm trying to fix her.
And you were a resident.
And I wasn't a resident. I was a medical student.
Medical student. That's hard.
So I knew nothing.
And you were busy. Like, what do you do? Quit or figure out how to do this with, like, that schedule?
Juggling all those balls. And it was really the unpredictability that was so hard.
Right.
And but I think one of the smartest things I did is right away I reached out to the chairman of the Department of Psychiatry at ORU, where I went to medical school, and he was so helpful. So tip number one for caregivers is find professionals you trust that can help you in a difficult situation.
Yeah, because if you're in over your head with something you don't really understand, it can be dangerous for you and the other person. So if you don't really know, even if it's something physical, a physical problem, and you're trying to take care of someone, you can end up inadvertently hurting someone if you don't know how to manage it. So,
well, and one of the most common things that happens, and it happens with nurses, it happens
all
with doctors,
the time,
is called compassion fatigue. It's, initially you just want to be so helpful. You want to jump in and fix the situation. But when you begin to realize the issue is chronic, that it's not like an infection, that you give them an antibiotic and 5 days later everything's wonderful, then over time you get worn out. And so tip number 2 is you got to take care of yourself in the process.
Well, and you also need to take care of yourself physically, because the other problem with nurses is they get physical injuries a lot. So if you're taking care of someone else, you are oftentimes sacrificing your own, your own posture, or you're doing certain things that you wouldn't normally do because you're taking care of a person that you love. And so you might be even doing things you're not supposed to do, lifting and doing things. So you have to be really careful and make sure you're doing things the correct way. Get the help you need.
And you've been a caregiver ever since you were a little girl, because you spent a lot of time caring for your grandmother,
Yeah, I
who
helped
had
out.
diabetes and
Yeah.
I remember one of your stories is when you were 10 or 11 and they taught you how to give
I was
shots.
11. Yeah, when they taught me how to give shots to an orange, insulin shots.
Right. But you couldn't kill the orange.
Right. It was scary. It was a scary thought. Yeah.
Right. So, what triggered Caregiving Week is someone close to us had surgery.
Right.
And she has 2 children. And so not only were you there for the doctor visits and the surgery, we then had her stay at our house.
With the kids. And the one thing I want to say to to people who have more than one child, dear Lord, it's busy. I'm busy with one child. And all of a sudden I'm like, oh my gosh, I have 3 stops to make. Oh my gosh, I have like 3 kids to get to different things. It was crazy. So, and then there's, and the amount of food that people go through when they have a whole bunch of kids is insane. I had this huge like awakening to this whole idea of having a house full of kids and people and someone you're taking care of at the same time. It was pretty crazy. But the first thing that I did, and I'm really lucky that I can do this, and I want to acknowledge that I am grateful and lucky, was delegate. So because I am able to ask for help, I've got an amazing community. It's one of the things we talk about is your social circle and making sure that you've got a community around you. So do your best to find people that can be helpful to you. Because you were helpful in the mornings. You're gone during the day, but you're super helpful in the mornings. But
I made breakfast.
Made breakfast and would help drive the kids to school. But then also I've got other people like, assistants and things like that at work, which they're not used to doing that. They had to like sort of rally. But try to find people who might be able to help out because it got a little crazy because I had a person who can't bend or turn or literally like turn her head or do anything for herself. So leaving that person alone is probably not a good idea. So it gets challenging,
So what were some of the emotions you had to wrestle with?
Mostly just fatigue. It was mostly just rushing. I can't get all of this done, being fatigued, at the end of the day, being tired. Oh, no, that's not true. Most of the emotions I wrestled with were being completely annoyed by the medical system. That was my primary. I was so annoyed and just, it was, I'm not that patient. I'm an ICU nurse. So when I see incompetence, I'm not super empathic toward the person who's being incompetent when I'm trying to take care of someone I love.
But it's actually not effective to be a pansy.
Yeah, I wouldn't call me that.
Dealing with the medical system.
Well,
no, I think what you did was very effective. And I think it would be instructive for caregivers. So when the person is not used to dealing with the medical system and they want to be liked rather
that was
than
my sister.
Accomplish what you need to. So she would call and be
She
really
didn't
nice.
want to be a pain. She didn't want to be a burden. So she wasn't telling the truth about what she was really going through. She was trying to sugarcoat it and using way too many words. And then they were like, literally basically getting her off the phone and not doing anything. And so I'm like, okay, let me help you out with this. And where I learned this from was because when I went to work on a level A trauma unit, a neurosurgical ICU unit, it was a combined unit. That is one busy unit. And in defense of the medical system, in defense of the physicians, okay, just to play both sides, they're overwhelmed also. They're like, it's a busy, hospitals are busy places. So they're going to they triage. They take what's the most critical, the most important, and that's what they focus on. Anything else, they're going to push aside. And if you can't impress upon them that what you're trying to say is important, they're not going to take it that seriously. They're going to push it off until later. And so when I first went to work on a unit like that, the first thing that the nurses told me when I went there, you're going to get eaten alive. You are not going to survive here. You're way too nice. And I had no idea what they meant. It took me about a week to figure out I was way too nice. Like I was getting shuffled aside. So I learned how to be very clear, make my first words count the most, be very, not just clear, but very assertive in how I say it. So get it through quickly and adamantly.
And you don't have to be mean.
No,
you are assertive.
You are assertive. You are adamant.
Meanness doesn't get you what you
Well,
want.
what is it that they say? So, honesty without compassion is just cruelty. So, but you're not always super compassionate when you're trying to deal with a whole bunch of doctors and no one's listening to you. Like, you learn how to be pretty intense.
So I love what you said. Make the first sentence, make the first
Count.
words you say meaningful. So say what you need
Right up front.
up front.
Use less words because they're busy.
Now, when it comes to caregivers, I want you to practice saying this. I have to think about it. So when someone asks you to do something for them and you have a full plate, so many of us, I used to be like this. I mean, you want to be liked and you want to be nice and you see yourself as a nice person. And so someone says, hey, can you do this? Oh, yes. And I don't want you to do that anymore. What I want you to do is, let me think about that. And then just take a moment and go, does this fit the goals I have for my life and the time I have?
For your family.
And if it does, then go, yes, I can do that. But if it doesn't, go, oh, I'm really sorry. My schedule is just so full. I cannot do that.
One thing I learned from you, and I really like this, is you don't have to just say no. It's, no, thank you. There's a way to say things and there's a way to say things. You can say the same thing and one can sound harsh and one can sound kinder. So, or not right now. That was the other one that you taught me, was not right now. I can't do it right now.
In the mirror in the morning, I have to think about this.
Right.
Because too often people just say yes when then they get overwhelmed and they not only hate themselves, they hate the people they're caring for. So when we come back, we're going to talk about if you have children who are hurting or emotionally troubled. How do you deal with that? Stay with us.
If you're enjoying the Brain Warriors Way podcast, please don't forget to subscribe so you'll always know when there's a new episode. And while you're at it, feel free to give us a review or 5-star rating, as that helps others find the podcast.
If you're interested in coming to Amen Clinics, use the code PODCAST10 to get a 10% discount on a full evaluation at amenclinics.com. For more information, give us a call at 855-978-1363.